Scleroderma Month, a time to raise awareness about this autoimmune disease, which leads to chronic hardening and tightening of connective tissues. The skin becomes hard, and it can also affect internal organs. My guests are Dr. Monique Hinchcliffe, Director of the Yale Scleroderma Program, and patient Melissa Marquis. Welcome to you both.
Thank you.
All right. How many people are affected, Doctor, by scleroderma?
In this country, we estimate that 150,000 to 200,000 people are affected. So it's a rare disease.
So it's a rare disease, but it doesn't sound rare if there's 200,000 people or so.
We have 370 patients currently enrolled in a registry at our Yale Scleroderma program. So
how rare can it be, actually? All right, Melissa, you've been diagnosed with a facsimile thereof. Tell me about symptoms.
Well, my symptoms are pretty wide-ranging. Some of them are skin-related. I have a lot of gastrointestinal issues, difficulty swallowing, slow motility. I've got some, lung and possible some heart symptoms that we're still trying to parse out whether or not it's related. So there's a lot of what seem very random symptoms at times.
Hard to live with?
It can be, definitely. Yeah.
All right, what is new research on the horizons about diagnosing somebody, doctor?
I think the push has been to diagnose patients earlier. So our mean disease duration at the time patients come to see us is 6 years. And so that is when a lot of damage has already occurred and treatments are less effective. So there's a big push to get patients in early, get them diagnosed early, and to commence treatment. One big win for I think for patients is the recent development of the outpatient IV epoprostenol program. So epoprostenol is a very strong medication to dilate blood vessels, and previous to COVID, we had to admit patients to the medical intensive care unit to receive that treatment that can spare digits, literally spare people from losing fingers. And with COVID, it became clear that we needed to be able to administer that patient in the outpatient clinics. And so last August 2023 was our first patient.
Why does it take so long to diagnose?
I think because the symptoms overlap. A lot of connective tissue diseases have similar symptoms. So Raynaud phenomena with the fingers changing color in response to cold and stress. GI issues, as Melissa mentioned, lung and heart problems are so prevalent in our society that I think it's often misdiagnosed as a different disorder.
I see. Advice that you have, Melissa, for folks who are diagnosed with scleroderma. How do you take this on?
One bite at a time. It really is literally one day at a time with this disease because it changes. I like to think of it as predictably unpredictable. It's just, you just know that there's going to be something new that pops up, and it's kind of like a game of whack-a-mole. At least that's how I see it for myself. Where you can be faced with one set of symptoms one day, be fine the next, and then have something completely different happen a day or two later, or sometimes even in the same day. So I think just being diligent, being aware of your body, your symptoms. We know our bodies best, and being an advocate, being the best self-advocate you can be, and not take no for an answer, and keep seeking opinions, in different doctors if need be.
Doctor, is this hereditary?
There's a component of genes that play a role, but it's not a single gene mutation. It's many genes contribute to the risk of getting the disease, and then we think that there's an environmental insult that occurs, and that could be a toxin or an infection. That's still an active area of research.
All right, well, thank you both for spreading the word about this rare disease, although there's a lot of folks suffering from it. Really appreciate it.
Thank you.
Thank you.
And if you'd like to know more about scleroderma, go to WTNH.com or the NewsAid app. We'll have more for you there.